journal. The benefits of exercising far exceeds the risks. Even persons who had a stroke or a heart attack will benefit from exercise. But there are risks involved, and everyone should obtain a clean bill of health from their doctor before beginning an exercise program. The PARQ assessment is a guide for appropriate exercise programs. It was created by the British Columbia Ministry of Health and Multidisciplinary Board. They followed the recommendations from the American College of Sports Medicine. The American College of Sports Medicine wrote the standards for health and fitness. The PARQ is a guideline to help determine one's health status, what exercises are appropriate, if any equipment, props, or spotters are needed, and if there may be any health restrictions. The main reason for an assessment is to make sure there are no possible cardiovascular, pulmonary, or metabolic risks. Also, body composition, level of flexibility, and baseline joint range of motion are important to take into consideration. Strength and endurance testing should also be performed, and a review of family history should be taken into account, as these are all factors of an individual's level of fitness. Safety is the main concern. There are some individuals who should not exercise due to their health status, and some will have limitations, and therefore some exercises will not be appropriate. Anyone over 65 who has been diagnosed with a heart issue or has been sedentary for some time are required to have a doctor's clearance. In fact, most fitness facilities require this be completed before signing up for a membership. Exercise affects our heart rates, our blood pressure, metabolic responses, our muscles, our cholesterol and triglyceride levels. It also increases our aerobic capacity. Age is a huge factor when determining what exercise is appropriate. Also, things like if you smoke or just recently stopped, or over age 35, or have family history of heart disease before the age of 60. If you are overweight, have high blood pressure and cholesterol, or have diabetes, people with chronic inflammation health issues such as lupus, rheumatoid arthritis, or osteoporosis, they all benefit from exercise, but the exercise program must be tweaked. When we create an appropriate exercise routine, we must focus on the intensity, the duration, and the consistency of the various exercises. These guidelines help us create these appropriate components for our individual health needs and our health status. My results on the Rockport Fitness Walking Test showed that my fitness level is excellent. I walked the mile in 14.2 minutes and my heart rate went up only 20 beats per minute. However, on the PARQ, I had to answer no to one question. I had to answer no because of my neck injuries limit some of the exercises I am able to do. It does not affect my walking ability though, and since I walk every day, I walk fast and without much cardiovascular and respiratory endurance. Our textbook states that cardiorespiratory endurance is the most important component of a health-related fitness. I could improve my exercise program by adding different types of exercise, such as resistance training and stretching, to improve bone density and better range of motion flexibility. And quitting smoking will greatly affect my health. Being sedentary creates so many negative health issues. Being active with daily regular exercise, the body becomes stronger and all of the organ systems start functioning more efficiently. It makes us feel better, and when we feel good, our moods are improved. We sleep better, have more energy, and get sick less. It helps slow down the risks for major diseases and disabilities, and if we don't use it, we will lose it. It is important to maintain health, keep our bodies strong, flexible, and accident-free, and people who exercise generally stop other unhealthy habits, have a higher quality of life, and live longer. I believe exercise affects all the dimensions of health. Our bodies must maintain health so that we may be at optimum functioning in our jobs, our social activities, and our intellectual health, our emotional health. Our emotional health greatly declines when our physical health deteriorates. It is important to maintain all the dimensions of health, and one assured way of accomplishing this is by a good daily exercise program that is appropriate and safe for you and your health needs.